healthcare-focused tech firms are springing up right across sub-Saharan Africa, especially after the coronavirus pandemic highlighted some critical gaps in the continent's medical supplies chain. More than 60 new and existing private firms are now distributing health products to consumers and to hospitals with tech platforms up and down the continent. From Kampala, CGTN's SSENYANGE now explores how medical call centers and social media platforms are helping patients in Uganda.
LETICIA IGUMA has been under lockdown. She spends most of her time at home. That's left her worrying about how she'd access a doctor if she needed a checkup.
Right now, there's so much that's going on, and more we are getting away from physical contact. And so, apart from the cases where we really need to get to a doctor physically, I think for these other cases, we should be able to embrace this new technology.
That's where telemedicine is increasingly stepping in.
Hello, this is DR.PAMELA from Rocket Health.
The service helps patients contact medical personnel who can immediately diagnose and recommend treatment through telephone calls or messages on internet platforms and apps.
Telemedicine is a different module of healthcare delivery. So for it bases on the fact that patients can get healthcare services remotely. So that means that they don't need to be in the same place as the doctors.
This private health service has seen a huge increase in clients over the past year. That's partly been because of the growth of medical insurance schemes in the country. The doctors here receive hundreds of calls every day. The interaction with patients has mostly been on COVID-19 related issues. Moving away from the face-to-face consultations, the doctors say is keeping them and their patients safe. Telemedicine is a major shift in Uganda's healthcare service. According to the World Health Organization statistics, there is one doctor for every 25,000 patients in Uganda. It's a gap the technology could potentially reduce. And it could also lead to cheaper access to health services for patients.
Routinely, people would get medical consultations at physical clinic at prices above $25,000 or $6 to $10. What we've done is through our teleconsultations, people can get consultations with a doctor for as low as $3 and sometimes even cheaper. And this is from the comfort of your home. So more people have been able to access a doctor, which they would not be able to do previously.
But roadblocks exist for online-based services. Uganda recently imposed the 12% tax on internet data, making access more costly.
It means that fewer people may be able to benefit from technology-enabled or internet-enabled healthcare services, which is a shame. Also, there's the challenge of internet connectivity. That is improving over time. However, there are still also regions and parts of countries where you do not have stable broadband or other internet connectivity, which allows for things like telemedicine.
But as more people get online in Uganda, combined with the restrictions due to the pandemic, telemedicine is likely to play an important role in the country's future healthcare provisions. SSENYANGE, CGTN, Kampala, Uganda.